There it is. Okay, yes, calling on Dr. Tran, Lisa, all our first set of speakers, if you can come up, Valerie from Velocity, if you guys can come up and just be on standby, we're gonna get started. Hello, everyone. All right, let's get started. Thank you so much for being here at the first ever community clinical trial health forum. Can we get an applause for that? As founder of Diverse Research now, I am excited to embark on a journey to better health with my community. DRN is not just an organization, it's a movement fueled by passion, purpose, and a relentless commitment to equity in healthcare through research studies. It is our mission to address the lack of diversity in clinical research by offering unique programs and services that focuses on community engagement, advocacy, and support for individuals who have been historically underrepresented in clinical trials. Our theme this year, Be the Breakthrough, emphasizes the power of community to pioneer change and drive innovation in research. By advocating for diversity and equity in research, we not only break through barriers, but also unlock new perspectives and solutions that benefit society as a whole. At DRN, we stand on the foundation of a simple yet profound belief. Everyone deserves access to the benefits of medical research. Yet, we cannot ignore the stark reality that minoritized groups remain vastly underrepresented in clinical trials. This disparity continues health inequities among communities of color, a challenge we are steadfastly determined to address. Our mission is clear: to break down barriers and empower people of color to participate in clinical trials. We provide education, support, and advocacy every step of the way, ensuring that minoritized participants feel informed, protected, and valued throughout their clinical trial journey. But our vision extends far beyond participation. We envision a future where health equity is the norm, where clinical trials reflect the rich diversity of our communities. That's why we're not here to recruit participants. We're here to engage, educate, and empower. DRN is dedicated to fostering a culture of inclusion in medical research because we firmly believe that good science is inclusive science. And by amplifying diverse voices like yours, we can unlock the full potential of medical breakthroughs for all. Follow us in this vital mission as we inspire a new era of inclusive research. Together we can make a difference, one trial, one participant, and one community at a time. So get ready for an exciting day of discussion and discovery. This is your opportunity to use your voice. Ask questions, share your concerns, and dive deep into the world of clinical research, clinical trials, medical advancements, and healthcare innovations. Remember, your swag bags include notepads and pens, so jot down your thoughts and be ready for our Q&A session. Make sure to visit the sponsor tables. In the left corner, we have Cognitive doing 5-minute memory assessments, and we have a kids corner to the right. And don't forget about our delicious food vendors outside. Let's make this an engaging and informative experience together. I want to recognize some of our board directors here that are present today. Dr. Young Tran, who you will hear from soon. Dr. Mina Rashid, who is over at the Kids Corner, along with Dr. Linda Loren and Dr. Simi's Daly. You can identify us because we're all wearing our normalized inclusive research shirts today. Now, to introduce Dr. Aaliyah Frederick. I'm sorry. Welcome. Now to introduce Dr. Aaliyah Frederick, our lovely event facilitator, whose IG bio reads, Beauty, Brains, Mom, Educator, and Advocate. What a powerhouse she is. Dr. Aaliyah Frederick is a child neurologist at Rady Children's Hospital and an assistant clinical professor of neurosciences and pediatrics at UC San Diego. She is currently conducting research looking at migraines in children. Do you have get your flyers out? Okay, so her flyers are out by the Kids Corner to give you more information about her migraine studies. So please give a round of applause for Dr. Aaliyah Frederick. Good afternoon. I don't know about you guys, but I'm really excited to be here. I'm really excited for this first annual event. I'm sure it'll be getting bigger and bigger every year, but I'm excited to see that this opportunity was brought to the community to just really learn about clinical trials and really engage in kind of how can we participate more, how can we be more engaged, and if you have questions, to get those answers so that you feel comfortable taking the next step of participation. So we have some great vendors and sponsors here today, and we're going to hear some presentations from them. I'm going to bring up 5 of them up here on the stage. The way we're going to do this, I'm going to call them up individually. They're going to come up stage, they're going to take a seat, and then each of them will have about 5 minutes to give you a presentation about their work. And then we'll have a Q&A session after the first 5 speakers present. All right, so first we have Dr. Trin from Healthy Brain Clinic and Tongue Out. Let's welcome to the stage. We've got Lisa Thurman with Common View. Let's welcome her to the stage. We've got the Executive Director, Rhonda Smith with California Black Health Network. Let's bring her to the stage. We've got Dr. Kim Wolf with the Opt-in Study, Osteopathic Treatment of Plagiocephaly. And we've got Valerie Ford, the Site Director for Velocity Clinical Research. So the presenters may have slides or may not. If you have slides, we do have an answer here so that you can click through your presentation. All right, so Dr. Trin, you're up first.
Okay, thank you for the invite here, Renata. I am very excited for an organization that exists, that is needed in a huge space of clinical research. Did you know that every medication that you take today, prescribed, was once a clinical trial? Crazy when you think about that, right? Did you know that there are clinical trials today where 90% of the participants do not represent America? COVID vaccine studies, 90+% white. Alzheimer's studies, 90+% white. And it goes on with the clinical trials that are being tested to be used by all Americans. And you know, we don't realize it, but we pay the consequences of that. There are medications prescribed today to millions of Americans where we are learning after the fact that either it doesn't work in certain populations that are underrepresented, Asians, Hispanics, Blacks, or whether there are side effects that exist in underrepresented populations who were never part of clinical trials. And we learn this after the fact because 90+% of the participants in these clinical trials were white. So we're here, and this organization is here, not only to bring equity, not only to bring fairness, not only to bring access, but just as important, safety. How do you know this medication works? For Asians, for Hispanics, for Blacks, for those who didn't participate in these clinical trials. How do you know it works better? How do you know it works worse? How do you know there are side effects? And we are learning. There are medications out there that you may have heard of. Plavix is a blood thinner. Does not work in certain populations that are underrepresented. There are blood pressure pills that have higher risk of side effects in the Black population than the Caucasian, that are prescribed to everyone today. There are seizure medications that are prescribed to every American that we learned doesn't work in certain underrepresented populations. This is after the fact, after FDA approval, guys. So we're here to try to fill this gap. And you can tell that this is just the beginning. We're going to get the word out. And so I'm certainly very excited to be part of this new organization that is leading the charge. And we're going to be loud, friendly loud, but we're going to have a voice in research to let folks know and to bring awareness to our community. The community that don't have access to clinical trials. Not everyone is next to a UCSD, right? Not everyone is next to a academic medical center. And not everyone even knows what clinical trials are. So we're here to educate, we're here to get the word out, and we're just getting started. So thank you so much.
Good afternoon, everybody. My name is Lisa, as you know. Backwards, sorry guys. My name is Lisa. I'm with CogniView. I actually brought one of the units with me, so everybody can check it out if you'd like to have a memory assessment. CogniView is a digital memory assessment tool that is used in both standard of care by primary care physicians as well as neurologists. I've had the wonderful pleasure of also piloting the device in clinical research studies. And what it does is it really identifies potential abnormal or cognitive problems. It isn't an MMSE, it's not a diagnostic tool, it is a good flag. It's been used in several clinical trials to potentially pre-screen patients that have a complaint of memory loss or just brain fogginess. And it's been very, very useful in identifying people that potentially could have the early stages of Alzheimer's dementia or mild cognitive impairment. The thing that's great about it is that it's portable. It can go into any community. It can be used in a healthcare setting. It can be used in a community setting. And it really does bring assessments into the community, and that's what we're really trying to do. Access resources. There we go. It interfaces well, Wi-Fi, electronic charting systems, and it generates a really comprehensive report. It tests visuospatial, your recall. It really is kind of a wonderful tool in the community, and it's fast. There are two models. One is the Clarity. That is a more robust assessment that is used by neurologists as well as audiologists. It's about a 10-minute test. And there's also the Thrive, which is a 5-minute test, and it's more appropriate for a quicker assessment, done in the community, done in health screening events as well. It's adaptive testing. It adjusts the difficulty level based on your performance. It never tests the same test twice, so as I said, it's adaptive, and it's portable. The great thing is it can monitor cognitive decline over time. So if you get a baseline assessment, your normal 1 year, you come back the following year, you do a follow-up, and you start to have a collection of history and timeline of your cognitive capacity over a period of time. So you can really monitor your own brain health as well as your primary care physician can as well. non-invasive. It enhances the other cognitive assessments that your neurologist or primary care physician may do, like an MMSE. And it promotes a proactive management between your primary care, your specialties. It's only going to increase assessments in the community and at the healthcare level. It's secure, confidential, and if you don't have Wi-Fi access, it also has a portal that is HIPAA compliant and secure that your health administrator or your physician can also access. And the results are immediate. It's an overall wonderful tool, both in a research setting and in a healthcare setting, to really identify potential abnormal and identify other chronic conditions that may be causing cognitive impairment or memory loss. It really empowers the patient, the caregiver, the physician, and the researcher to really help identify, manage, and track your cognitive capacity. Thank you.
Thank you. Hi, I'm Rhonda Smith. I'm the Executive Director of the California Black Health Network. We are a statewide organization that works to advance health equity for all Black Californians. That includes African Americans as well as Black immigrants. We are here today because part of the work that we do is around educating our community so that they can become more empowered individuals as well as patients, and work and navigate through the healthcare system in a way that really makes the healthcare system work better for them. And so for the work that we do to try to close the gap in health disparities, breaking down those barriers that prevent people from participating in clinical trials is part of the work that we do. We know that historically the Black community has experienced some medical atrocities and some medical mistreatment, and there's a lot of mistrust because of that. So we try to work to educate our community to remove those barriers that individuals hold on to because of things like the Tuskegee experiment or the Henry Lex story and many other things that have happened throughout history. And so it's important to know, like Dr. Trent said, to participate in clinical trials in a number of ways. One, to make sure that the drugs, when they're in market, actually is efficacious for everyone, and so that we can get better outcomes when it comes to whether it's heart disease or diabetes or hypertension or anything else. It's also good from a life-saving perspective. If we have patients or individuals who are going through an advanced cancer diagnosis and all commercially available drugs are not working for that individual, then there's an option or hopefully opportunity for that individual to participate in a clinical trial. So making sure that our community is aware of that so that if they are faced with that situation, they know that they have the right to ask for the opportunity to participate in experimental treatment or in a clinical trial. So again, I think knowledge is power, and we try to do our part to make sure that our community, number one, knows what their patient rights are, they know how to have a conversation with their healthcare provider, no matter who or what type of provider they're dealing with. They know how to navigate through the healthcare system. They know how to advocate for themselves and their loved ones, and also participate in the decision-making for their care. And so we would love for you all to become members of the network and stay connected, help spread the word about the importance of participating in clinical trials, spread the word about diverse research now. And I won't say much more, but what I do want to leave with is I really want to congratulate Renata on getting to this point. I met her in October last year, and she was telling me about her ideas about this organization. And I want to take a moment to really celebrate her, commend her on the amazing work she's done in a very short period of time to have us all in the room today. And hopefully next year when we're back, we'll see all the seats full. So can we get a round of applause for her? Wherever she is in the room. But yeah, so thank you very much. Again, we're at the table back there. You can grab some information, become a member, and happy to answer any questions about the work that we do. Okay, thank you.
Haley Wolf. I'm a pediatrician, and I'm here to share with you a little bit about the work that I'm involved in. I'm honored to be here. I think this organization is so necessary and important. I'm also faculty at a medical school, and a big part of what I teach is the importance of diversity and better representation and better care for our patients with these considerations. So I love this organization, what they represent. I'm honored to meet all of you and excited to share what we're doing. So our study is called the opt-in study, which stands for osteopathic plagiocephaly treatment for infants and neonates. So plagiocephaly, I know that's a lot of big words, we'll break it down. So plagiocephaly, for those that don't know, is the infants with flat heads in the back, or asymmetry of the head. And why this is really important is it's often taught as it's a cosmetic issue, and doctors will talk about that and address that. But really what happens is if you've got a shift in the back of the head, you've got a shift elsewhere, including in the bones of the face of that developing infant. And that can lead to problems down the line with eyes not aligning, which impacts vision, with teeth not aligning, which can lead to problems with needing dental or orthodontic problems, ear and sinus infections, developmental delays, and very commonly torticollis, or the twist in the neck, where a baby can't turn their neck either way. Why is this important? This is on the rise. In the last 20 to 30 years, they've seen a 600% rise in the incidence of this. And there's very few studies that actually study the breakdown of different races or ethnicities in regards to plagiocephaly, but it really seems to be an equal opportunity condition that's represented and seen in a variety of communities. And so we want our research to be reflective of that as well. The current treatment, as many may have seen, are these helmets. These helmets, though, are not ideal, in my opinion, for a number of reasons. Happy to share more about that if anyone wants to know. But one of the biggest things I dislike about them is they're cost prohibitive. They cost somewhere sometimes between $5,000 and $10,000, which really restricts who has access to them. And so what we do is actually use our hands to very gently treat and reshape those heads. And that's what we call osteopathic manipulative treatment, or OMT. And although I'm speaking about OMT specifically in regards to treating infants with flat heads, OMT can be used to treat any number of conditions. I've also done research looking at OMT to treat autism spectrum disorder, babies who have trouble breastfeeding, asthma. I've been involved in a number of studies with it, and so it's really powerful. In adults, for those of you in the audience, you most commonly think of us for low back pain, joint pain, things like that. We're great for headaches as well. And feel free to stop by and take a flyer if you'd like to learn more about that. So, for those who would join our study, they, in addition to receiving all treatment from the physician free, they also can receive up to $550 additionally to compensate them for their time, gas money, etc. And so we really want this to be valuable for them. Our clinic is located down in Kearney Mesa, and if that's an issue for us, for anyone, please talk to us, and we'd like to get creative and see how we can help get you there if you've got a family that you think might be interested. All of our materials are available in English and Spanish. I speak Spanish, and so we have, again, all of our consent forms and everything else available in Spanish as well. We're hoping to expand to additional languages in the future. Again, representation is critical. It helps us truly know if we are representing our population. As you said, most drug studies do not represent Americans. And so we want our research to truly be representative of the community that we are representing and treating. So please help us if you, again, know families who might be interested. Pass it off and keep us moving because I know I only have a few minutes. If you would like to learn more about us or the work we're doing, feel free to follow us on social media. That's our website, Instagram, and Facebook, and we'd love to have you stop by our booth and learn more as well. Thank you so much.
Yep.
Hi, my name is Valerie Warren, and I'm here from Velocity Clinical Research. We have two offices in the San Diego area, one in La Mesa by Grossmont Hospital, and the other one is down in Chula Vista by Sharp Chula Vista Hospital. We are the world's largest clinical research organization. We have about 90 fully integrated sites in the US and also in Europe. We partner with pharmaceutical and biotech companies through drugs and medical devices. We do diagnostics that can improve human health and well-being. Our studies are all led by licensed healthcare professionals, and all the clinical trials that we do are overseen by the FDA. So we have, as I was saying earlier, we have 90 fully integrated sites, and this is the dispersion across the US and the world and Europe. One of the things that Velocity is very dedicated to is the improving and increasing diversity in clinical research for all the reasons that you've heard today. And one of the things that's really important about this is to make sure it's accessible, that the locations for clinical research are in areas that people can get to of all different communities, to the point where we have moved sites from one part of town to another, and in order to make it more accessible, we be near public transportation and be within the communities that it serves. Our vision is to improve lives by making clinical research available and accessible to all. So in addition to being where the communities are, we also go out. And so we have our booth there with Lizette, one of our coordinators, and try to be out in the community, talking and educating people about clinical research as much as possible. But really, it all starts with people like you. Without clinical trial participants, it would not be possible to create these new medicines, treatments, and cures. And it's important to have a good representation of everyone in these cures to make sure it works for everybody. Oh, that slide's coming out strange. Okay, but why participate in a research study? I mean, one, you can learn about new medicines. And when you're part of a study, you get study-related exams. You get more exams and treatment and follow-up than you might get just from your regular general practitioner. All the studies that we do are focused heavily on patient safety. So you have regular visits with a physician and can learn more about your own health. And most studies pay for your time and travel. So in addition to receiving all of this healthcare for free, you will receive payment for your time and travel when you participate in a trial. And of course, it helps to move science forward. So in Velocity Clinical Research within the San Diego, we have several actively enrolling studies. And these are indications that affect a large swath of the population: type 2 diabetes, obesity, cardiovascular health, fatty liver, warts, vaccines. We have a whole swath of things. But I wanted to talk a little bit about why fatty liver was an important and big focus in research today and how we're addressing it. So 1 in 3 people over 40 have a fatty liver. And like, well, I don't notice it, what does it matter, right? But what happens is over time, these fat deposits in your liver cause inflammation. And that can lead to fibrosis and cirrhosis and eventually liver cancer. But this is reversible up to a certain point. If the certain changes that need to be made don't happen before this certain point, you start to get into these irreversible, really terrible things that can impact your liver. And fatty liver is now the biggest cause of chronic liver disease today. Who's at risk? A lot of us who have some sort of metabolic syndrome, diabetes, overweight, obesity, high cholesterol, blood pressure, a lot of these things are what contribute to it. And it is found to be in a higher prevalence in the Hispanic and Latino communities due to genetics. And 76% of diabetes are on the spectrum of liver disease. So that increases your risk significantly. So because it's so important to get involved and learn about the health of your liver early, we at Velocity, we offer a service to our community by doing something called a fiber scan. This is a non-invasive test of the liver, and it's really similar to an ultrasound, where there's going to be a probe that goes right by your liver, so that you can learn about your health. There are few treatment options. Only just recently was the first drug that can treat fatty liver has been discovered, but it's only for a really small segment of the population. So right now, there are a lot of studies out there to work to try to identify ways to treat this, and that are available at our site and other sites throughout the country at the moment. We also offer free of charge hemoglobin A1C checks at our site. They are fast, 5-minute tests, just involves a little prick of blood on the finger, and that can tell you how your blood sugar is managed throughout your body, and it's a diagnostic tool used for type 2 diabetes. All these things are really important to be discovered early in your disease state, so that's why we offer it for your community. If you're interested in learning more about these things, or if you want to participate in the study, the phone number is up here, or you can come out to our table and learn more. There's also a website and an app that we have that can match people to clinical trials, and all the information is back at our table. So that's it. Thank you very much.
Thank you for those wonderful presentations. I certainly learned a lot just in those, hearing a couple of minutes from each of you about what you're doing about right now. We have some time. If anyone in the audience has any questions that they'd like to ask of any of our speakers, we can take those questions.
It was a great panel, and I took time to listen to each and every one of your groups, other than the young men over there, and spoke with your individually, so you have a distinct understanding of who I am and what I'm about, and I believe that. For you, young man, it was quite frightening what you just elaborated on in regards to the trial studies that only relate to one particular ethnicity. And the FDA is complicit, the FDA is complicit in regards to allowing these particular studies just to take notice only for a specific ethnicity. But they allow these drugs to come into the community. And when they allow these drugs to come into the community, and knowing that a particular study has not been taken up in people of color, Hispanics, Black, whatever, right? And they sell these drugs to these same communities, and they see all the death that is taking place. Why they continue to allow this to happen, knowing that the drug is not effective enough to help everyone that exists on the planet Earth. Now, I know that everyone on the planet has some sort of, all of us in the ethnicity-wise, blood-wise, black, white, green, whatever. Why does the drug not specifically affect everyone? That if we have all of us as a unit, why does it not affect that? Is this by design? That's in regards to the pills. Secondly, right, I believe that to address these issues, the panel should focus more on what a person eats. I'm 70 years old. I haven't eaten pork since 1965. I do a lot of fasting. I drink a lot of water. I'm healthy, so I would say some sort of a testament as to what a person needs to do to stay healthy. And it's just frightening what y'all was talking about in regards to, medication, side effects, more pills, more pills, more pills. The more pills that you take, your liver's not going to be able to digest that. It's just going to shut down. It's just going to be for
We'll let Dr. Tran answer the question that you asked.
All right, great points, great points. And I believe that most of us will agree that we should let our food be our medicine, right? But there is obviously a role for medications. And a great point on the history of how clinical trials have been done. And the good news is that in the last few years, the FDA is taking notice. And the FDA is starting to ask the question about diversity. After realizing that certain medications work better for certain groups, certain medications may have more side effects for other groups, that was discovered after the fact, right, of FDA approval. In the field of research, when new clinical trials are coming my way, I'm starting to notice that in these new clinical trials, there is a push for diversity in all these new clinical trials coming our way. And it is a group effort to bring awareness to those communities who may not be aware about clinical trials, to educate, to improve access to communities that may not have access to clinical trials. But yes, your food should be your medicine, 100%. So thank you so much for that comment.
I'm glad that you brought up that point about the FDA taking notice. I believe if you want grant funding from the NIH, your grant actually has to include a section of how you are including diverse participants in your trials. And also for clinical trial, you submit to IRB, which is the review board that actually reviews the presentations put forward for clinical studies. They actually do ask for how are you planning to recruit diverse participants in clinical trials also. So there are a couple different organizations that are asking for that specifically in applications. You have a question here? Do we have another comment up here?
We work with a lot of organizations across the state, and a lot of them are in life sciences. And I do know that what I'm seeing and hearing, like Otsuka back there, they are prioritizing and making sure that their clinical trials are more inclusive and more diverse. So I do see that happening, and Dr. Trent's right. So the FDA is starting to take note and making sure that, I don't know if there's legislation that has been passed yet, but making sure that there, at least the percentage of participants in clinical trials reflects the percentage of diversity when we look at the Black and Latino, as well as AAPI population. So we want to make sure that we know 16%, I think, for African Americans. Yeah. So there are things that are happening to make sure that clinical trials are more inclusive.
I want to add that it's not just the FDA, as she mentioned, Otsuka, Eastside, a lot of the larger pharmaceutical organizations are really requiring clinical trial sites to submit diversity plans with their feasibilities. There really is a push to incorporate health equity into the study design of these protocols, these clinical trials. And it's not just in clinical research. Medicare also has their new guide model that is going to start in 2025 in July. There is a specific section of that guide that requires every single organization that is going to participate in the guide model to have a health equity plan in place before they even apply. So it's not just in the research environment, it's also in standard of care. It is important, it's impactful, and everybody is starting to really just focus on this issue.
What's important though is making sure that it's more than just words. It's very easy to write these things down. It's another to have an actual plan and actually carry out a study that is inclusive. And I believe that's why all of us who are here today are here, is we truly believe in that mission, not just talk the talk, but walk the walk. Yeah, I can attest that definitely a lot of the larger pharmaceutical companies today are coming to us, asking us for our diversity plan and how we plan to include everybody that we say that we will into our studies. And it isn't just talk, it's they have to have it, or else the FDA is not going to approve their drug. And we have to be talking in the communities. We have to work to gain the trust and put forth that education. Like, I could go out and say, well, we want to begin a trial, but I mean, you're not going to trust me off the bat. We have to teach and educate and make sure that people understand what's going on and what things have been put in place over the years to make sure that trials are done safely, with informed consent, with the knowledge of what's about to happen as we participating in a trial. Those are really important things that have improved over the many years since the atrocities that happened long ago.
Yeah. My name is Mansour. I'm a primary physician in East County. Working in the private office, and also I'm the medical director of the Medical Therapeutic Clinic in the East County, which is an FQAC clinic. Really, I'm impressed about the services you are presenting here today. I have two questions. One of the questions about the peaks, you mentioned that the patients with the flat oxygen, is this the only indication for this issue? Because we have many children with mental retardation, ADHD, or autism, and they are eligible for a lot of studies and activities and monitoring. Is this included with the studies? My other question is the Alzheimer study saying that it's going to be monitoring only the behavior. Is any medication is going to be implemented or just monitoring? And if the patient already on medication, is he eligible for monitoring?
So one question was for me, correct, with the pediatrics and the plagiocephaly study. So the indication for this specific study is plagiocephaly, which is the flat spot on the back of the head. And we're enrolling only children under the age of 5 months, with the intention that if they still desire other interventions later on, they're able to get them and have not missed that window, such as a helmet. I agree with you, there's a number of other conditions that we can benefit, and we do treat all of those. As I said, I've been involved with, specifically, I partnered with, I used to work up in the Bay Area, and I've worked with UCSF to treat children with autism spectrum disorder with OMT. We had really amazing results with that. I treat children with cerebral palsy and get really impressive outcomes. My own daughter struggles with hypertonia, and we get her treated for that. So, and we've had amazing results with her. So again, we treat all of those things, but our study is specifically aimed at plagiocephaly.
I can speak on the Alzheimer's question. We've been involved at Healthy Brain Clinic with a lot of Alzheimer's clinical trials. And the studies that are done are more than observational. The studies that are done is interventional. What that means is that there are medications that are being evaluated currently that is designed to address the underlying pathology of Alzheimer's, which is the Alzheimer's plaque. You heard about the plaque that builds up, the amyloid, the beta amyloid, the tau tangles, and all that. And so the studies being evaluated, a good number of them are immunoglobulin, immunotherapy type studies where we're utilizing the immune system to remove the Alzheimer's plaque that builds up. And so these are treatment studies more than observational studies.
Just concerned about the autism. I know that you hear that lot. There is a lot of families taking their kids to some centers in Mexico doing the stem cell implants. Is there any study similar here? They are looking for the impact and the benefit of this treatment.
I'm sorry, stem cell transplants for what?
Stem cell implant.
For what condition? Autism. Oh, I am not qualified to speak on that. I'm just not as educated on that specifically. Apologies. Any other questions? All right, well, I'd like to thank our panel of speakers. That was a great presentation, so it was a great discussion. There have tables here in the back, so if you haven't already had a chance to visit the tables, feel free to do that. If you have any additional questions, you can speak with them one-on-one. Let me switch the mics. All right. Are you guys ready for a raffle? Did you guys know we're giving away free stuff here today? The prizes are pretty good. Have you guys been visiting the tables? So that's the way that you were able to get your raffle tickets? All right. Well, we're going to go grab some raffles so we can see who's a winner right now. All right. Take a moment, get your ticket out. I need to see a ticket to get a prize. Okay. All right. So we've got the San Diego Blood Bank brought us these bags here, and there's some prizes in there. So the first 3 raffles this morning are going to be for one of those bags. So I've got 707087 winner. What? Are you a winner? All right. Which one is he getting? He's getting one of the San Diego Blood Bank bags. All right. Next I have 707078. Woo, got a winner right there. Another bag. There's that. All right. 707056. Right here, we got another bag. This gentleman right here. All right, now this next one here is for another bag, but there's something extra added into it. There's a Target gift card. So it's a little bit of a step up. Let's see who's got that one. Here we go. 707173. Do we have a winner? Someone said all right back there. Who was it? No. No, going once, going twice. Next we have 707088. No? Going once, going twice? Oh my God, okay. Right here. Oh wait, oh yeah, that one's there, okay. So that's one, and it has a Target gift card added. All right, here we go. Big morning prize. This one's for 2 tickets to the San Diego Botanical Gardens. I did pick one, but I can keep you for next time. 707061. Going once, going twice. All right. 707133. Somebody better come pay this bar. Take it home myself. Going once, going twice. 707084. Going once, going twice. 707212. All right. Is he sure? Can someone check that ticket, please? All right, it's 4 tickets. Excuse me. I thought it was 2. It's 4 tickets. Two, 1, 2. All right, so we have, congratulations to all the winners. So I believe we're going to take a little break right now. We're going to come back with our second panel of speakers. We'll be doing another raffle also after that one. So if you didn't win right now, we have some more really great prizes coming up later on. So if you didn't get a chance to get go visit the tables, and get your raffle tickets, go ahead and do that, and we'll be back with our speakers in a little bit. Hello. Oh, okay. I'm sorry. So we'll be just on pause for about 5 minutes, but if you can get a bite to eat, we do have food vendors outside. The delicious smoker. The smoker is here. He is serving up, I believe, burgers, fries, wings, and then we have Soul Sirop outside as well. They have vegetable lumpia, pancit, and I believe fried rice. So you guys go ahead and get you some food. Them Soul Sirop, they're right here. I'm sorry. We're gonna start back.
Oh, no, 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 no. My question was, As long as I think we
Lucky Saturday, I go meet today, cause I miss you every day. Call me any day, I'll be on my way. I'm not far away. I'm not body, get action, give action. Everything my I love you with passion. Yes, it's you, get it for my action. I will see me down, from the get to you, baby, person. Get a awesome. See that you only you want this action. Yeah, I'm alright, for my get down. When I need you, I want for my passion. Girl, I'm not here to get confused. Girl, I'm only here to get confused. Get a love for me, enemies. Me, I love your baby, enemies. Come on, me. Give me the give me my energy. I love you, feel me. Don't leave me alone. Baby, let me take you to the beach. Anything that I want. Let me take you to the beach. I will give you everything you want. And I go down, I go here. You give me too long, but I go here. I be my feelings, and I just want to make you go. Tell me where you get. Lucky Saturday, I go meet you there. Cause I miss you every day. Call me any day, I'll be on my way. I'm not far away. My body, get action, give action. Everything I love you with passion. Yes, it is every for me action. I will see me there, no one for me get you. You know, baby, awesome. Get awesome. Say that you only you want this action. Yeah, I'm all about for my cat down. I'll make you what I want for my passion. I only fear me. I'm on local, send me the payment. I bought a motor, it's a service. I saw the debit, Lagos City, set on the shore if you reach out. Great one, like on the girl who trust me, all for the wicked. And the man ain't greedy, but the money man go, but the money man knows it, the money no show, the money no sell, because I got no credit. Anything goes, and the money man says it. Only on gets it, the belly takes it. All of me running, millions, I see millions and millions. I see for millions, millions, I see millions and millions. I see for millions, billions, I see billions and billions. I see in Napoleon, billions, I see billions and billions. I see in Napoleon, the bells in the air, nobody can tell me no, I love you. Nobody will show me no, but I want to say I feel. I can never be myself, nobody in the fun, la la. You know me like a girl, Sasa. You know me like a girl, Sasa. She wanna see me like that. She pull up to my shows, la la. You put the iman, so la la. You put the iman, so la la. Oh la la. I need you, I need you.
Breakfast, lunch, and dinner, we drink money. Now they wanna snap pictures, I live fashion. You don't stop me, mom, they walk better than it. Impossible, every day is a celebration. This one for all my people that couldn't make it. Spent nights on the blue night and the station. I said no comment just to make a statement. I hate me because I'm winning. I hate you kicking, my only ain't ticking. 150 to leave the hour moving. Now they wish they could catch a man slipping. SHOKOLOEPNGOSAT, my sugar look and bando shit. Anywhere I go, you know I can't get it. Please, yeah, you know my passion, money and high fashion. Anyway, you see me, you know the boys pattern. I was a young G with dreams of getting rich. Now I got more money than I imagine. That I hate no, speak no, see no, even. Never catch me stumbling on my own people. That's my brother from another mother. I got the slice precise and with evil. She made hard to get some, keeping the same energy. You want to get some needles and the Hennessy. Take a shot to the head, that's a Kennedy. Yo, find your sit that gingerly. They love sit that gingerly. Unforgettable slide, they remember me. Hypnotizing like an oldie melody. I came with the criminals, my code, defending me.
Hello? I don't know if they can hear me outside, but I'm hoping, okay, they're coming back in. We're gonna get back started with the presentations. So sorry for the long intermission, but everyone went out there and wanted to eat, so delicious food vendors outside. They're coming back in. They never had a pretty girl from Georgia, so they know that's what they got from. Don't touch no inches, I got a show for us. Just means I can get job. As you don't what did you tell me? All right. I don't think my microphone's working. All right. Now the microphone wasn't working, but we're going to get started because we have another round of really great speakers to let us know what they're doing here in the community and what they're doing as far as clinical research and how we can get involved. So if you are the representative for these organizations that I'm about to name, please come on up, take your seat on the stage in the order that I call you, and then we'll be coming up one by one to make our presentations. So, can I get someone from the San Diego Blood Bank? All right, who do we have?
Name's Javier.
Everyone, I'm Javier Castillo, San Diego Blood Bank.
All right, we got Javier from the San Diego Blood Bank. Atsuka? All right, we met earlier. Who do we have?
Hi, I'm Andrew Nguyen with Brookska.
All right, come on up, take your seats. Altora, expanding health research and clinical trial access to diversity. Wonderful. Who do we have here? I'm Lisa with Altura. All right, Lisa, come on up and take a seat. Neighborhood Health Forum. All right. Who do we have here? Sandy Orta. Sandy with Neighborhood Health Forum. Go ahead and take a seat, please. And we have Black Woman Inflammation and Tau Study. All right, come on down. Who do we have here? Hi, my name is Joy. Right, we've got Joy with the Black Women's Inflammation and Tau Study. So you guys will be able to come up individually and let us know what you learned.
You guys hear me? Hi there, so Javier Castillo, I'm the VP of Marketing at San Diego Blood Bank. I'm super excited to be here. First off, thanks again to Diverse Research Now, to Renata, Ray, and the rest of the team. Really appreciate the work that you guys are doing here. It's so important, and we're just really ecstatic to be here with you guys and to support you and to continue supporting you as long as you guys are doing the work. And today I'm here to present at your Community Health Forum on how San Diego Blood Bank is advancing health equity one drop at a time. Where do I point this? Oh, there we go. So if you're not familiar with San Diego Blood Bank, we are San Diego's only regional blood center. We've been around for nearly 75 years. Next year will be, 2025 will be our 75th year anniversary. Every single year, we welcome over 50,000 volunteer blood donors at 10 fixed locations all over Southern California. And we have 2,000 mobile drives in partnership with the community every single year. And what we get from that is we're able to supply over 100 of our hospital partners, research partners, and medical facilities with more than 150,000 units of blood product every single year. We're the primary supplier for Rabies Children's Hospital, and we're also a national leader in innovation in healthcare through our All of Us participation and Precision Blood Program. I'll get into those. Oh, I guess I was. All right. Our mission is connecting diverse communities to save and improve lives through blood and biotherapies. One of the ways in which we are doing this is through the All of Us program. So, as you know, and as you guys have heard here today, especially from the previous panel of doctors, is that too often healthcare is a one-size-fits-all approach. But imagine a future where prevention, treatment, and care are tailored specifically for you. All of Us is a research program that is funded by the National Institutes of Health, and they're on a mission to invite 1 million people that are actually representative of the population of the United States to participate in medical research. We're a leader in the program. We actually created the core protocol from San Diego Blood Bank for blood centers that are supporting this initiative, and we onboard and train blood centers across the United States to help with this work. So, as has been mentioned, historically the Black community has been mistreated in health research. Just like we said before, there's a Stevie Syphilis study, and then what happened with Henrietta Lacks. And while there are now researchers and health providers that are wanting to do the right thing, it requires partnership from this community. It's a little bit of a chicken and the egg scenario, right? You can't do things for the community unless the community is working with you. And we can only improve health outcomes by working together. So in participating, we invite you to participate in all of us. We are proudly partnered with SDSU's Center for Equitable Research and Diversity Equitable Diversity in Research. They're at the back. If you're interested, please talk to them to get you more information. Precision blood, this is something that we are super proud of. Most of you know that the current standard for blood transfusion is based off of A, B, O, the basic 8 blood types. But what isn't well known is there's actually over 30 blood groups and over 300 different antigens. These are different surface proteins and carbohydrates on your red blood cells that can make a difference in how well your blood matches whether you're a donor or recipient. It's a generally safe process. There's nearly 18 million blood transfusions that happen in the United States every single year. And while, people with the current process, while people aren't going to die from getting a blood transfusion as long as the blood is properly typed, there's undetected differences that if they go unrecognized, untreated, that can create poor results over time. The most, with the people that are most at risk are those who are multiply transfused. Okay. This one, okay. So who does this impact? If there's over 18 million people, or nearly 18 million people getting blood transfusions every single year, why do we care if nobody's dying? So while the majority of transfusion patients rarely encounter major problems, the two categories of patients that have the most impact in this are cancer patients and those with sickle cell disease. They have much higher risk, again, because they're getting transfused multiple times in their lifetime, sometimes for their entire lifetime. And sickle cell disease impacts the Black and African American community the most. It occurs in 1 out of every 365 Black and African American births. That means that while it doesn't affect the majority of the national population, it largely affects the Black and African American community. So it's important that we do better here. Next slide, please. So what is precision blood? Our blood program examines a person's blood at the genetic level. I had mentioned there are over 30 blood groups and 300 different antigens. We look at all of them, and we use that information to better match donor blood with the patients who need it. Next slide. So precision blood, just high level, it allows personalized blood matching that is proven to be safe. It's scalable. We're trying it already. It's been seeing great results. But we need to make it available for everyone. In order to do that, we need participation from the community. So our work at the San Diego Blood Bank supports local patients' needs now. If you go into one of the local hospitals, especially those ones that are the primary provider, you will get the blood that you need. If you're in an accident, if you're a cancer patient, if you have sickle cell disease, there's blood on the shelves. But we're also advancing standard of care for blood transfusion patients in the future, and a huge part of that is creating equity in blood transfusion patients. Go to the next slide. Yeah, perfect. So, but to do this, again, we need the support of this community. We can't do it without you. Folks, and these here, the 4 pictures on the right, these are team survivor patients. So these are ambassadors that have volunteered to share their stories because they're so important to the reason why we do this work. Folks like Brianna, who's going to be on the left side, top left, and Selena next to her, they were born with sickle cell, and Brianna needed transfusions early on in her life, and Selena will need transfusions every single month for the rest of her life. Rainey, who's in the bottom left, she went in for just a standard annual checkup, and she was found to have dangerously low red blood cell count, and she needed immediate treatment. Her life was saved because of blood donors. And then Charlene, who's in the bottom right, she needed multiple blood transfusions in order to help her beat colon cancer. So these are real people in the San Diego area that are only here today because of people who come in and donate blood. Only 1.5% of our blood donors at San Diego Blood Bank are Black, but the Black community makes up 6.5% of the San Diego population. So that's a problem. We can only improve health outcomes for our communities if we step up together, and your involvement honors past injustices by helping pave the way for future generations. Now, if hopefully I've convinced you of the importance of blood donation, what does that mean, what does it take? We're going to go on to the next slide, and DJ D-Rock's going to share his experience.
Hey, what's going on? It's DJ D-Rock from Hamburg Z90, and I'm a little nervous right now. I have the option. Never giving blood. But after I spoke to someone about how important it is to donate, especially if you're a minority, I couldn't hold out any longer. I mean, did you know that only 1.5% of our blood donors are Black? We can do better. So here I am at the San Diego Blood Bank in the Mount Hope area, donating blood for the very first time. And I encourage you to do the same. After all, it's free. Only takes about 10 minutes, and you can save up to 3 lives. Plus, the snacks afterwards are awesome. For more information, please head to SanDiegoBloodBank.org.
So if I were you, I'll let DJ D-Rock know that you guys applauded him. It's good. If I were you, I'd follow his advice. Come out. We have centers, like I said, all over San Diego. Donate blood. 15 minutes of your time could save up to 3 people's lives. Thank you.
All right, hello community. All right. So, hi everyone. My name is Andrew Nguyen. I'm here with Otska, and I just want to say it's such an honor to be here for this inaugural event with Diverse Research Now. So, a heartfelt thank you, Rhonda, the volunteers, for this moment in time and space, and I think fearlessly kind of leading the charge to ignite this important movement, right? To really lift up diversity, equity, inclusion, diverse today and tomorrow within our clinical trials, for patients, for caregivers, for our communities and our families. So just wanted to start by saying that. Thank you, team. So just a little bit about Otska. Otska is a healthcare pharmaceutical company, and our mission is to improve health globally by filling the gaps created by complex, underserved, unmet medical needs. And we're leading in terms of our therapeutic areas that we work in. We're primarily focused in kidney diseases as well as CNS or central nervous system disorders. So when we think of diseases like PKD, depression, PTSD, Alzheimer's, all those kind of indications around mental health is something that we're really passionate about in terms of valuing every mind. And I just want to say it's also incredibly emboldening to be seated here alongside, local organizations, local leaders, community partners in this commitment to emphasize the importance of clinical diversity, diversity in clinical research. And I think Dr. Trin, Rhonda, you said it so eloquently earlier, but the importance of diversity in our clinical trials. I mean, when we look at the statistics, right, Caucasians currently make up 58% of the US population, but when we think of the clinical research that drives, medical medicine development, they make up about 75% of more than, depending on different indications, over 75% of clinical trial participants. So that means, right, other races, our Black, Latinx, Asian, Native American brothers and sisters, right, only make up about 25% of kind of clinical trial research, despite being like 42% of the US population. So, and as Dr. Trin kind of mentioned before, when we think of, why this is important. Our bodies are different, our communities are different, the determinants of health that we navigate, right, are different. And so, in order to create effective, safe drugs and, beyond drugs, right, other interventions, this is why we need, holistic, comprehensive participation from all our communities. And that's basically why OTSCA is here. As a sponsor of clinical trials, I think other folks have mentioned before too, like we're trying to do the right thing, but there's so much more that needs to be done. And the only way to do it, right, is to truly do it together and to really, really work alongside each other. So families, patients, caregivers, providers, that's the way that we can truly, I think, make enduring social impact and social change. And so, at least for Otsuka, in terms of our efforts within, trying to expand diversity for clinical research, we've done this in a variety of different ways. We have a community-centric clinical trial awareness campaign that's nationwide. So through that, we really partner and support, local communities, local community-based organizations, events like this, to really, again, be present and listen to the community and invite communities to the table when it comes to, developing, again, different interventions and think about the ways that we can make medication and access to healthcare more accessible, more inclusive. We also assess, in terms of the research process, every doctor that runs an OTSCA trial goes through this really robust kind of assessment so that, we ensure that from a DEI perspective, right, that they can really truly reach their diverse communities and serve them effectively. Also with our clinical trial sites, we're constantly working on trainings that we roll out in order to help folks better support patients from different backgrounds and different topics. And then, we also implemented a comprehensive protocol review board for each study so that, with diversity and inclusion, those kind of values built into the clinical trial design process from the very beginning. So I know I kind of said a lot. Fortunately, we don't have fancy slides, but I will say if you're interested to learn more about clinical research, how you can be involved, how you can kind of integrate your voice at the table, and more importantly, also how OTSCA, the sponsor of research and development, can better support, your communities, your mission, your organization, your programs. We are here to listen, we are here to learn, and really, again, be part of this movement to drive towards a future where medications, research and development, science really captures all of this. So, thank you.
Good afternoon. My name is Lisa, and I'm with Altura. I'm happy to be here today and be a part of this event and have the opportunity to share with you the importance of diversity in clinical trials and how community members can become involved and participate in clinical trials. Altura has been partnering with community healthcare organizations for over 15 years to facilitate community access to clinical research studies for diverse populations. We are dedicated to expanding access to clinical trials and health studies. We have a multilingual team certified in cultural competence with a passion for clinical research. We offer a state-of-the-art technology to find and share study information with community members to help link members of the community with local study sites. Clinical trials are important in order to find new and better ways to diagnose, treat, and prevent diseases. Clinical studies must have diversity, as we've heard from so many today, to ensure that the research is representative of the entire population. Without diversity, researchers don't know how different groups of people will respond to a treatment. Participants in clinical trials have access to cutting-edge treatments that are not available to the general public, as well as access to expert care and very close monitoring of their health throughout the study. There are different types of clinical trials. Treatment trials test new medications, new uses for medications that are already on the market, and new procedures like different types of ways to perform surgery. Prevention trials focus on better ways to prevent diseases, such as current studies looking for ways to prevent dementia. Diagnostic trials seek better tests for diagnosing diseases or conditions. The Michael J. Fox organization recently developed a new diagnostic biomarker test for diagnosing Parkinson's disease. Screening trials test new ways to detect diseases. For example, researchers test less invasive and more effective screening tools for things like colorectal cancer. Quality of life trials explore options to improve comfort and quality of life for people who suffer with chronic conditions. Clinical trial participants report a high satisfaction in participating in the trials, rating their experience 8 or higher on a scale of 1 to 10. And over 96% of participants would recommend a clinical study to family and friends. Altura has developed an app to help make it easier to find clinical studies in the community. Our research engagement platform is free. The app is a tool not just to find research studies, but also to catch up on the latest research news and participate in online surveys. It provides access to local, regional, and national online studies that can easily be shared with friends and family. For more information about the HCP Studies research platform, please stop by our table and pick up a flyer. We'll also be happy to help you download the app for free. And as a bonus, Altura also offers a healthy aging program. It's a home-based program that provides access to a specialist and resources to support strength, mobility, and balance. As a special giveaway for attendees today, we're offering free enrollment in this program, so please stop by the neighborhood healthcare table and talk to Altura to get more information. Thank you.
Hi, everyone. Thank you. I just want to say thank you to Bernarda for inviting us to be here. We've been working with her for a few months now, and I really appreciate all the work that you're doing out in the community. So I'm with Neighborhood Healthcare, and we're federally. So Neighborhood Healthcare is a federally qualified health center, and we have locations throughout San Diego and Riverside County. So you might wonder, why are we here at some of these where you're discussing research? So about 3 years ago, Neighborhood Healthcare launched into clinical trials, and we did it for all of the reasons that you've been hearing from everyone up here. Because of the population that we serve, we have a very racially diverse population. We thought it was really important that our patients be represented in clinical trials. So just a little bit about Neighborhood Healthcare. As I mentioned, we're a federally qualified health center. We have over 110,000 patients throughout San Diego, Riverside County. Last year, we did about 460,000 visits. We offer many services. All types of specialty services, women's health, prenatal care, we have a PACE program, which is a program for all inclusive care of the elderly. We're getting ready to open our second program as well. So a interesting fact, and something we're very proud of, was during COVID, Neighborhood Healthcare administered 130,000 vaccines to our patients and the community members. Prior to 2021, when we launched our clinical trial site, we participated in a few observational studies, but really did not participate at all in clinical trials. So here, anytime we launch anything in neighborhood, it's really important that we understand what our goals are. So these were our goals as we launched clinical trials, and the number one goal was equity. We wanted to make sure our patients were represented. And for the same reason that I've heard multiple people say here, our chief medical officer said, I don't know how many times I go to prescribe a drug and I'm not sure how it's going to work on my patient. And he just felt very strongly we wanted to make sure that we are including racially diverse patients in clinical trials to make sure that the medications that are being approved and the doses that are being approved will actually work. There were some financial reasons for us doing this as well, and it's a very low amount, but basically anything that we make profitability goes back into neighborhood healthcare to further our mission. Our main mission is that we will never turn a patient away. So most of our patients have Medi-Cal, but any patients who are unfunded, we will also see them as well. But there were some soft benefits that came out when we launched clinical trial. One of the things, if any of you probably have watched the news at all, during COVID, you heard a lot about provider burnout. A lot of providers leaving, nurses, doctors leaving the field because of just feeling burnt out. Well, this actually gives our providers an opportunity to do something other than what they were doing on a day-to-day basis. It also was a great career lab. It gave us the ability to, all of our coordinators actually were previous medical assistants within our sites. So I'm going to just really quickly go through this because one of the things, I'm going to break protocol. I'm going to ask my colleague Maria to come up and share her journey because as I sit here and look at people, you might wonder how did neighborhoods get into clinical trials, but then how do we train up our staff? And so I'm going to let Maria share a little bit about that. So here are our numbers. So like I said, we launched a little less than 3 years ago. Right now we have 12 active studies. We've completed 5 studies, 44 active participants, and actually that number probably gone up since I put the slide together. We've consented 96 participants. We enrolled 65 participants. And we also were part of a UCSD study where we enrolled 511 participants in a COVID No More study. So I'm going to go ahead and ask Maria to come up and share this.
I'm short, sorry. Hi, good afternoon. Thank you, Sandy, for the introduction and thank you for the invitation. So, my name is Maria Yana. I am the Operations Supervisor for Clinical Trials for Neighborhood Healthcare. I started working in neighborhood healthcare about 15 years ago as a medical assistant. I was brought into by our regional program, and the need for bilingual staff is something really important. Growing up, coming from a Mexican-American family with my parents being immigrants, I was born in Mexico, raised in San Diego. For me, it was really important that we had people like me working in the clinics. I remember growing up, going to visits with my parents whenever we actually went, because they were working 24/7 to put food on the table, not really to provide healthcare for us, as many of us probably here endured during our childhood. So the thing that would go with them, they never had anybody who would speak our language. I actually had to serve as a translator. I had no healthcare knowledge, so sometimes, what the providers or the nurses were telling me, I had no idea how to tell my parents. So for me, it was really important to have representation. About 3 years ago, in neighborhood healthcare, I wanted to start with the Institute of Health, which is our clinical trials department. I myself was a little bit hesitant. I never really knew much about clinical trials other than, what I was presented at school during my undergrad program. But I said, it's a great opportunity. I did research and I said, I'm going to move forward. I want to go ahead and start this amazing program. Here now, as Sandy presented, 3 years later, I'm so excited about the work we're doing. This organization just represents everything. It's the diversity. Being able to work day in and day out with our patients, being able to provide consent with them, tell them exactly what they're signing, giving them the information in their language. Not only that, but being available for them 24/7, being that bridge between us and their primary. That's what's really important to me. And for me, it's also had given me the opportunity to grow a career. And I do solely see myself working, continue to work with neighborhood healthcare and grow our community clinical trials department, and really come here to our, events like this and talk about what is the importance, as many of our colleagues have said today. Representation matters and diversity is important, but also not only in the patient side, but also in the working field. As a operations supervisor, I had all the roles. I am also the coordinator. I call patients. They're able to text me, call me. That's what's really important. We also need, workers. We also need from the other side, and it's a great career path and really important. So thank you so much, and that's just a little bit about my story.
Good afternoon, everyone. My name is Jory. I'm a doctoral student at UCSD. I'm also a graduate student researcher for the Black Women Information and Health Study. There we go. So the Black Women Inflammation and Tau study is an observational study that's multi-site, so it's taking place at both University of California, San Diego and the University of California, Los Angeles. So you might be asking, what is tau? Tau is a protein found in the brain that has been linked to Alzheimer's disease. And why is this important? Well, approximately 6.7 million Americans are living with Alzheimer's disease and related dementias, and 2/3 of this are women. And Black African Americans are twice as likely to receive an Alzheimer's disease and related dementias diagnosis compared to their white counterparts. And Black African Americans are the most at-risk demographic group for Alzheimer's disease and related dementias in their lifetime. So what are some of the risks for Alzheimer's disease? There's a ton, as you can see, but some of the ones that are highlighted here in bold are some of the risk factors that are extremely common in Black African Americans. So that includes age, genetics, the head-to-heart connection, which is high blood pressure, cholesterol, etc. So what BWITS is investigating is how do these lifestyle factors impact tau accumulation and cognitive outcomes in Black women specifically. So this is a little snapshot of our study timeline. There's several visits. There's a screening visit that includes family history and demographics, questionnaires, some cognitive testing. Then there's a baseline visit, which is in person, that happens at convenient locations within both San Diego and Los Angeles. And this baseline visit includes cognitive testing, blood draws, questionnaires as well. There's a 7-day actigraphy period where we're learning about people's daily physical activity. And then there's a 12-month follow-up visit and a 24-month follow-up visit in which we get some additional information. For some reason, this slide isn't showing everything. But what makes our study unique is that we're community-based and community-focused. So we use a community advisory board that we work with that pretty much helps us to make sure that every single component of our study is culturally sensitive and safe for the communities that we're hoping to serve. We also provide health results to our participants. So throughout the study, they can learn a little bit about themselves. And then there's monetary compensation for their time as well. So you may be eligible if you are a Black woman, 60 years or older. So this is just a shot of our research team. Once again, we're located in Los Angeles and San Diego at UCSD and UCLA. And if you'd like to learn more about the study, then you can contact us here, or you can take a picture of our information, use our QR code, and you'll get some information about our website, phone number. We're also set up in the back of the room, so you see Nadine waving right there with the BWIT sign. If you have any questions about participating in Alzheimer's disease research, or specifically participating in the Black Women Inflammation and Tau study, please feel free to come up to us and ask us any questions that you have. Thank you all.
All right, so that was another great panel, lots of information shared there. I'd love to open it up to the audience now, and if you have any questions, to direct at our panelists. For the blood bank, after having chemo and not taking any drugs for the use of cancer, when can you give blood again?
I can't recall the exact deferral dates, but all of our information is easily accessible on the website. I also know that if you recall, there's a number on the website that can talk to you specifically about your individual eligibility.
I had a question for Senator Blood Bank. I know it might sound crass, however, you said you had a very low participation rate with African Americans. And I'm wondering, since I'm a veteran of at least 3 decades of clinical studies, have you ever considered actually paying for the blood draws?
Yeah, so Samuel Blood Bank currently, we're not profit, we operate at less than 1% profitability. And a lot of the money that, so for those of you that don't know, we do get compensated for blood products that are produced from our volunteer blood donors. And that money covers things like testing, manufacturing, all the processes that go into making sure that the blood that we receive from donors is safe, and then goes to those hospital patients. And I mentioned, so all that to say that 1% of that is the operating profitability, and it goes right back into making sure that we are sustainable and they're able to continue these services. We have looked at things like compensation, paying, and if you're not aware, there are also other organizations that, for example, they'll collect plasma and then they will pay for those services. There's actually a lot of reasons why some organizations, hospitals in particular, might think that might be less safe. That they're taking advantage of the community by having people come in specifically because they feel like, oh, I can get money this way. We've just found that for sustainability and for the health and safety of both donors and patients, that it makes much more sense if they're volunteer donors. Now, that doesn't mean that everybody can or is able to come in and donate. Obviously, some of the folks in the communities that we're trying to reach out to will have multiple jobs, or they'll have different situations in which they do need to make sure that they're using their time the best. For those folks, obviously, we wouldn't want you to do something that would endanger yourself, your health or finances or anything like that. But a lot of the folks that we do see are folks that do have the ability to volunteer and make that time available for donor blood.
Any other questions for our panelists?
I don't recall if I see if you have a mobile blood donation, you have a truck there. Have you guys ever made your presence felt at like cultural events like Juneteenth, Cinco de Mayo, or the TET celebration in Mira Mesa?
Yeah, so I mentioned we have over 2,000 mobile blood drives that happen every single year, and we'll honestly show up anywhere that we're invited and that we're able to work with the community there. One thing we don't want to do, we don't want to necessarily just show up uninvited or unannounced. There are, so sometimes we'll do like a parking lot or something like that downtown or in other places where it's open to the public, people can just come in. But for an event like, for example, the TED Festival, we work with typically whoever the event organizers are to come out and then to make sure that we're invited and that there's also, it's an appropriate situation. As one example, we have had situations where we're having a beer festival. Would you like to come and collect there? It's probably not the safest in that situation to have people donate blood and then go and drink. But just to answer your question, yes, absolutely. And if any of you have any connections with any of these types of events or organizations, we would love to come out and partner. One of the things that we like to do is, again, so back to the, the note about adding value and compensation. We do regularly do, prizes, incentives, rewards, things like that for people that do come and participate, usually by raffle. And the bigger the event, the more people we're likely to see, the more we can offer as far as those types of exclusive rewards.
Great. Any other questions for our panelists? Questions? We've heard a lot of information today, so we've got multiple clinical trials in the neurospace here. We've got a free app that's available, I believe, so make sure you check it out at the table. We've got community involvement, easy access, and we've got inflammation in tau, kind of, are you guys more of an observation study sort of thing? So looking at prevention. So we heard that earlier, kind of looking at different phases. It's not just looking at treatment, but also looking at prevention also. So, no questions, no questions? All right, you know what time it is. Thank you, presenters. I'll ask you to leave the stage and we'll get ready for another raffle. All right. We got some more great prizes here. Seven 707-135. I don't know. Should we give him the prize that I have listed here first? Should he get it? He should get it. It's the San Diego Gold Prize package. It's the box on the table there. Congratulations. The next prize on my list, I have a free plumbing and HVAC inspection from John Stevenson Plumbing. This is going to go to 707080. Any takers? 707080. No? Who? Oh, over here. All right, that's a free plumbing and HVAC inspection from John Stevenson Plumbing. All right, now I've got a couple more gift bags from the San Diego Blood Bank. I've got 707057. 707057. Oh, right here. No? She's just kidding. No? All right, 707090. Gift bag from the San Diego Blood Bank. All right, going now to 707168. Y'all better take this free stuff, okay? Whose number is this? All right. I don't have any more tickets. Who hasn't received a prize? Thank you for being here. We appreciate you.
All right. So we have DJ Diversity hit track from our partners Diversity Trials in Houston, Texas. I want you guys to listen to the powerful words of the song. We'll play it for you now. Hello? So we have another break here, so visit the tables. If you have any one-on-one conversations or anything, feel free. We'll be back at 4:30 for another chat. We'll have another raffle too, and then we'll be wrapping things up after that. So, food, yes, eat. Okay? If you did not already eat, please go ahead and visit our vendors outside.
Every time you say that you're leaving, girl, I know that's a lie. Every time I want you, you pull up one time. Look at my guy, who go tell me how I fall in my life. Trust me, I'll be alright. If it's about love, and it's enough, who is that for if it's no one of us? You can be flying in the air, or you keep telling you don't give a fuck. And I'm on my first dance, it was different. I just screaming while I let it burn. How did you fuck this one up? You have me caught, did it run. It's not our trust, when I find out, this is just trust, it's just us. Maybe we just love, but how do you want us? Why you acting? What are you for? Shady, they want me. You play, clever, who's up the way? Who got that eighty vibe? I still play with some more. She give me dumb break in a smart car. I don't wanna hear your lecture. Baby, come to me now, fights. Been a lot of nights. When you want to leave me, but I won't give you the vibe. Take you on a flight. Why you not to? Why you front to? Tell us not to. Never about nothing. Is it cause I'm deviation? Spending time. Is it just my trust? I got love. This is just us. It's just us. Baby, we just love. But I'll be no question. Why you want to? Why you want to? Sure, you perfect. Just me, I let it burn. I think it's fun, it's my love. You have me fun, say it for love. It's not my trust, I got love. This is just us, it's just us. Baby, we just love, but I'll give up on sin. All you want, all you for, shady, they have me. They play, Everybody's wondering what they gonna be. Even if they want to do, even if they die, I say I need. Would you be up to someone that I'm singing? I'm just waiting for somebody there. I ain't gonna get that for myself. Please come stay but don't forget. Should be them, now you're big. Please come stay. Why could you get your best in if I love you, the love that you show me, really like it up by it. Because I see from surface, the moment you do like this, girl, I got you always, you are desire. Wow, baby, I'm sorry, baby, I'm sorry. Take my love is out, show me love, every no desire, give me love. You do me well, baby, I'm sorry, give me love. Take my love is out, show me love, every no desire, give me love. I'm not in my calamera, I'm levitating, feel like to see on you. With my calamera, it's in the book on your and I wanna go crazy with you. So there to the sun. Do it up, do it when you walk up. And I don't know this. Girl, I belong. This must be love. You need me, wow. Got my mind done. Baby, I'm inside. You need me, wow. Take out a reason. I need me, love. Every no desire. You need me, love. You need me, wow. Got my mind done. Baby, I'm inside. You need me, love. Take out a reason. I need me, love. Every no desire. You need me, love. Everything you do, I like. My best friend is your my life. I'm not feeding you without. I feel you don't make it back in the shower. You want me to. Let me know that I did for you. I love you, want that for me and you. Everything you believe in, true love. You give me mercy. Let your best be no mercy. You deserve this, I love you. You love the way you show me. I really like it, I'm buying. Because I see themselves. You want me to like this. Girl, I got you always. You are desire. You need me, wow. Got my mind done. Baby, I'm inside. You need me, wow. Take my desire. You need me, wow. Take your desire. You need me, wow.
Ladies, do you want to take a picture? I can take a picture of you. Like both of you. Okay, I'll take one first.
I spend my day around second guess all of the steps I take. Jack cover me, I'm good. Trust my instincts, I'm so unstoppable. Sudden. What if you feel like something? Don't be so hard, that's my understanding. Say I'm resistant. Me, I will just keep walking. Hustle from money to Sunday. 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 Reflection on all the things I do. I'm not anybody coming at me, so with me, I know before reflection. Everything you go wrong, so this morning you won't go wrong. Never had to school, so I can't stop in a mental disease. I feel this in this truth. Whenever they find a new, I know they got to give me. I got community, I need more artists, not for one, so I'm not really something. Hustle from money to Sunday. 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 She don't wanna be there. Look at the body, she don't wanna be there. She wanna body, she don't wanna be there. You better go to the gym and be there. Give me the second reason. The last time she don't wanna give me. Waking up for me, it's a shame I have to be. I feel like I don't wanna be broke. Be like that, feel like I'm sober. I'm dedicated, cause I know that it's broke.
We're gonna wrap it up. Just have a few acknowledgements. We're gonna try to get some more people in from outside, but we're wrapping up here. 1 second. Yeah, everybody can come in. Everybody can come in.
As long as you're not, I'm gonna stick around. Isaiah.
Okay, we're gonna wrap up. So we have two, before I wrap up, we have two more bags to raffle off. And so I'll do that raffle now. So get your tickets. Not many of us left, but that's okay. Look, you might get it just because nobody's here. Okay, let me not, okay. So, ticket 78. Is 78 still here? No? Okay, I'm gonna just keep calling them. 83. 68. 68. You got it? Oh. Okay. 87. 87. Oh. 83. No, she. Okay. 60. I know 60 here. She got it. You're welcome. And 35. Who was 63? 83? Okay. We got our final two bags. Thank you. That was a tough one. Okay, so wrapping up, we wanted to leave a story with you. So we ask that you watch the video. It's about 6 minutes long, and then we will wrap up.
All right. You know what I like about you, Auntie Penny? What? When you're on fire, your auntie. You're hilarious. Yes, you know how to make us laugh all the time. I love that. Because laughter is key. And we have so many fun adventures. I love being at your house.
My personal mantra is to make it count, make the most of each day. And I didn't have that mantra until after my diagnosis. When I got the diagnosis, I can remember being in the doctor's office and hearing crying from other patients who got that same news. You diagnosed with stage 4. Well, I was as cold as ice. It wasn't about how long do I have to live. No, it was like, what are you going to do to help me stay alive? And if you can't, get out of my way. Had to fight my way to find researchers and advocates who were willing to help me stay alive.
About 38% of the U.S. population identifies as racial and ethnic minorities. But if you look at what is the population of the individuals that actually participate in clinical research, only 2 to 16% of those individuals identify as racial and ethnic minorities. Clinical research is important because that's how we advance medical knowledge. That's how we advance healthcare. We are still not moving the needle so that we are ensuring that the people that participate in our clinical studies represent the population that is most likely to benefit from it. When it comes to designing clinical research to be more inclusive and more representative, we need to have as much information as we possibly can about that patient population. So getting access to real-world data. At Sanofi, what we do is that we partner with companies like Diagnostics, where we get access to that diverse patient information.
It was hard sometimes. We had that clinical trial for 2 years, right? Remember you guys were feeling somehow. We stopped. Yeah. See, now it's coming together.
How difficult was it for me to get into a clinical trial? It was like trying to remember. Nothing was handed to me. No one offered me anything. I call it backdooring my way in. I got involved with the clinical trial by identifying myself to a researcher who was actually doing work. He confirmed that I would be a good candidate for the trial that was about to happen, and I went from having a 4% chance of survival to here I am now, 6 years in remission. Sometimes a clinical trial is the only care option that a patient with advanced cancer. I feel like had more patients known about the trial that I was on, they might have signed up.
At Sanofi, we work with companies like Diagnostics to help us get access to real-world data. We get access to diverse patient information. So we get information about age, about gender, about race, ethnicity, as well as location and other social determinants of health. And we use that information to help us when we're trying to design our clinical trials to be inclusive of diverse patient population. It's very important that we identify investigators who have access to this patient population and that we know exactly where those patients are so that we're placing our trials in those areas.
The Diagnostics platform works through aggregating de-identified patient information from different medical centers, including the one that I work in, Boston Medical Center. It also joins people who want to conduct a clinical trial to appropriate institutions. So instead of me spending a lot of time seeking out sponsors, seeking out site feasibility, Diagnostics did all the backwork for me. As a caregiver, as a clinician who treats young people, involving them in the clinical trial process at this age is really empowering to them. My job is to not only treat them, but my job is to make sure that their voices are heard and that they learn from a very early age that they can be included in this process.
Yes.
Clinical trials mean, to me, opportunity. As a person of color, I understand the history and the mistrust that comes along with the words clinical research, right? I also understand the value of clinical research, but I also understand the importance of understanding what it is and what you're getting yourself into. There can be some benefits and there can be some risks, let's be honest. As an advocate, I feel like it's a beautiful thing to empower patients to make informed decisions. My hope in the future for clinical trials is that the conversation about clinical trials happens earlier, helping patients understand the value of clinical research and the value of it early.
Thank you. We wanted to share that video. You can go to the next slide. I'm gonna wrap up here. But we wanted to share that video and leave Miss Karen's story with you. If you have been in clinical trials, we do invite you to share your story with us. And we want to take your stories and that information back to decision makers and make you a part of that. But today was about celebrating the researchers, advocates, healthcare providers that along with you, the community, are moving science forward. We want to thank all our sponsors for helping to make our inaugural community clinical trial health forum happen. Let's continue to inspire a new era of inclusive research together. To Dr. Aaliyah Frederick, our beautiful event facilitator, thank you for being here today, and thank you for your important research that you do as well. And finally, to our beloved community, your voices, questions, and insights are vital as we work together to ensure that clinical trials are inclusive and equitable for everyone. Remember, your participation not only helps advance medical research, but also paves the way for better healthcare for our communities. Let's continue this dialogue, stay informed, and advocate for our health. You can find us at our new location inside of Mid-City Church of the Nazarene at 4101 University Avenue, San Diego, California, 92105 on Tuesday and Thursday mornings from 10 to 1 p.m. And please follow us for more events like this we will be hosting. Together, we can make a difference. We will see you again next year. Thank you for coming.
Reach your back. Put your hands on your back. All right, there you go. Hey, stay over here. Someone will be walking back and forth here, all right?
mainstream.